Welcome back to Dr. Mustafa El-Safty. Today we're exploring a rare condition called periodic paralysis. What it is, why it happens, and how to manage it.
Periodic paralysis, causes, symptoms, and management. Periodic paralysis is a group of rare genetic disorders where people experience sudden episodes of muscle weakness or temporary paralysis.
These attacks can last from a few minutes to several hours and may come without warning, which can be frightening for patients and families.
Understanding the cause helps with treatment and prevention. The issue lies in ion channels, tiny gates in muscle cell membranes that control potassium, sodium, and calcium flow.
When genetic mutations affect these channels, the electrical signals that trigger contraction are disrupted. Muscles may fail to contract properly.
These are inherited conditions. Genetics often explain who is affected. There are three main types of periodic paralysis. Hypokalemic periodic paralysis, attacks linked to low potassium levels. Hyperkalemic periodic paralysis, attacks linked to high potassium levels. Anderson-Tawil syndrome, a rarer form that can affect the heart and facial features. Symptoms often start in childhood or adolescence and include sudden muscle weakness or paralysis. Weakness that worsens after resting from exercise. Muscle stiffness or cramps that may precede an attack. In some cases, irregular heart rhythms or distinct facial features can occur. Common triggers include food, exercise patterns, stress, cold, and some medications. Eating large, high-carbohydrate meals can trigger attacks. Resting after heavy exercise is another common trigger. Also emotional stress, cold exposure, and certain drugs.
Diagnosis starts with a full medical history and tests during an attack, including potassium levels.
Blood tests during an attack and genetic testing can confirm the specific type. Treatment varies. Potassium supplements for low potassium attacks, and potassium-lowering strategies for high potassium types. Medications like acetazolamide may help stabilize muscle activity, plus dietary adjustments to reduce attacks.
Managing periodic paralysis is a long-term lifestyle approach, not just pills.
Identify triggers. Keep a diary of meals, exercise, and stress to spot patterns. Dietary changes. Avoid large carbohydrate loads and maintain steady electrolytes. Exercise management. Regular moderate activity and avoid sudden extremes.
Be prepared for emergencies. Know when to seek urgent care if breathing or heart are affected, and keep regular follow-ups with specialists.
Educate family and build support networks.
With proper care, many people with periodic paralysis live full lives. If this helped, please like, subscribe, and share your questions below.